You know, the question is how quickly do you need to get in if you think that you might have had some changes from dry macular degeneration to wet macular degeneration. We use that Amsler grid to kind of screen and look, and you're looking to see if there's some wavy lines. And I think in general, you know, the sooner you can get in, the better. You know, is it an overnight emergency? Probably not. You know, the next day would probably be just as fine. It's hard to say because in some people, actually, we can see this fluid, and they may have been there actually for even a few months. They might not have noticed many changes. In other cases, things happen a lot more quickly. Sometimes when you notice the change on the grid, for each person, it's a little bit different. So some people might really notice every little thing, and other people might not notice until it's kind of more significant. But I think in general, when people are treated, your vision is usually a little bit, is better. If you start at a better point, you usually have better vision in the long run. So that's, you know, the earlier treatment tends to be better.
With respect to drusen, what are they, I guess, composed of? And is it something that the body generates itself, like scar tissue, or is it related to diet, for example?
So drusen are a metabolic waste product, and in the healthy eye, they're produced by the retina, and there are cells in the layer below the retina that will remove those. And so what just happens with time is that a large proportion of the population will start accumulating them, and that's the yellow waste product. So they're almost like a cholesterol waste product. It's not because you have high cholesterol in your bloodstream, but they are a type of waste product similar to cholesterol. And the second part of the question about the drusen? Right. Okay, so I'll repeat that. So whether the accumulation of drusen relates to food intake. And again, Dr. Mares will talk about that there are health surveys that show a difference in your chance of developing drusen depending upon, say, what proportion of different foods you take. So there is some relation, and she'll touch upon that, and that's part of why in the AREDS vitamins, for instance, that you'll have lutein and zeaxanthin. So products that are natural, for instance, you find them in the egg yolk a lot, and those can make a difference in your accumulation of drusen. So she'll give a long answer about that in her presentation.
I go to an optometrist and I go to an ophthalmologist, and they both disagree about preservision or something else. The optometrist thinks Macu Health is good. It's out of Europe. It includes lutein, zeaxanthin, and mesozeaxanthin. And the preservision includes zinc, and not the zeaxanthin, mesozeaxanthin, excuse me. And the optometrist did a cotton swab of my tissue inside my mouth and said, zinc is not good for you because of your genetics. So I'm confused. So what I do is take one pill of one a day and one pill of the other a day to please them both, maybe. And I called the NIH eye department and asked them, so where is the AREDS 3? Where is the new study? And they said, there is no new study. So what is your feeling on this?
Well, you're asking some really good questions. You could come and teach our residents. But the question of which supplement is the best, it's very difficult. What we have the best evidence for with over 4,000 patients in a 10-year study is the AREDS 2. So we do know in that AREDS 2 formula there is the high dose of zinc. There are many brands that have that exact formula, that AREDS 2 formula. So Macu Health, if that follows that formula, that would be fine. But it doesn't. So the zinc, the question of whether zinc should be modified based on your genetics is controversial. We really don't have an answer. And there's debate. In the end of the month, there'll be a big ophthalmology meeting in Chicago. There's debates about whether or not we need to test all of you for your genetic status. At this point, in my opinion, your genetic status is not as valuable to me as what I can tell by looking into your eye. So the examination and the amount of drusen, if it's mild or intermediate or severe, that helps me determine whether you need this supplement, not the genetic test. Because the genetic tests aren't perfect. They do the swab, they can send it into a company that does the genetic test, but if we took your swab 10 times, you might not get the same answer each time. So it's hard to hang your hat on a test that's not quite perfect. So in that sense, I don't think we're quite ready for prime time on the genetic testing.
3 going to be done?
Yeah, that we can all write our senators and congressmen, because that's going to take a lot of funds from Congress, from taxpayers, for another large study. So I agree, we need an AREDS 3. We need prevention studies to understand what's happening and how to prevent this disease, not just treat it on the back end. So there is no budget right now for an AREDS 3. So we need to push.
Yeah, so the question was, I showed a slide where someone had wet macular degeneration. We gave one injection and then that fluid went away and the patient felt better. So the question is now that fluid's gone away, is it back to being dry macular degeneration or is it still wet macular degeneration? I think probably a lot of doctors might answer that a little differently, but I think once you have wet macular degeneration, personally at least, once you have wet macular degeneration, you have wet macular degeneration. Now maybe over a few years, if that fluid stayed away, we might say, well, your eye is essentially acting a lot more like dry macular degeneration. But your body's also shown this kind of propensity or tendency to get wet macular degeneration. So some people might call it inactive wet macular degeneration. Other people might refer to it as that atrophy or dry macular degeneration. The terminology gets thrown around a little bit, kind of back and forth, so it can be a little bit confusing. But in that particular instance, just because they had the one treatment and the fluid went away, I would say that patient still has wet macular degeneration, because typically that treatment course may take a few years for that to not come back. And we might do that one injection, things clear up, but then over the course of a year or 2 years, we may see that patient back or be treating and notice that there still is some fluid that has resumed.
I've been a patient of both wet and dry, both wet and dry, and I started out with the cheaper shot. I should have gone to the next level. After I received that shot, my eye improved dramatically, and I think I've only had 2 in the last year versus 1 a month previously. Just a comment.
Thanks for that comment. And as you know, there are these 3 different drugs that we can now use. One is much less expensive because it was first developed for cancer treatment. We use a small dose of the standard treatment, which makes it much less expensive. Our studies at this point have shown that those drugs are equal if you looked at a large group of patients. Any individual, one person may do better with one of those drugs over another, but on average, those drugs do seem to be pretty darn equal in the treatment of macular degeneration.
This may not apply to a lot of people here. I have been receiving the injections for a few years, and you're right, the injection is not a problem. It's the iodine that's a problem. Is there a safe alternative to iodine? It's just making me nuts. I spend several hours in serious discomfort and or pain after an injection because of the iodine.
This is a common question that we get, and actually we had a meeting of all our retina doctors just about a week or 2 ago where we talked about this exact issue. We give these injections, there's a very low risk of an infection in the eye, which can be a really terrible thing if it happens. And one of the best preventative measures is a drop of iodine that helps to just keep the eye surface sterile and clean. And it turns out if you don't give that, your risk of an infection is much, much higher. So what are the alternatives? There have been some studies looking at other options, but so far nothing's available in the United States. I think what I tell my patients if they've been developing that kind of reaction is to let us know. There might be ways that we can either alter or kind of minimize or try to rinse out the eyes afterwards that might help with reducing some of that sensitivity that people can get from the iodine. But at least for me, it's very important that we do place that because, like I said, an infection in the eye, unfortunately, that can be a really terrible thing. You know, and so that's the reason that we do that. But we're looking. It's definitely a common issue that we're trying to find a solution for.
Yeah, I was told I had the start of AMD, and so I look at the chart every day, and on my left eye, I don't see a wavy line. I see a shadow with the line. My ophthalmologist said that has nothing to do with my AMD.
So even the earliest form of macular degeneration can have various symptoms. You know, waviness is an important one, and the Amsler grid will usually catch that. But many times when there's drusen buildup or there's early scarring, you're going to have other symptoms. So for example, early atrophy, you're going to have a spot that's blurry, and that spot or that line will slowly increase over time. So although waviness on the Amsler grid is one of the cardinal signs of macular degeneration, there are other symptoms which can be more subtle that cause visual impairment. The key, I think, for you is, you know, to watch this to see if really, is it changing? Is it growing over time? Is it changing suddenly and slowly? And obviously coupling this with regular dilated fundus exam would catch if there's really any progression.
I have my question has to do with referrals. I have both glaucoma and macular. I don't know which one. But if I wanted to have a referral from my physician to you, to have someone here look at my eyes, what's the process?
First, I'd like to, we'd want to make sure that it's possible through your insurance plan to be referred to us, but we are available at our main clinic, our University Station clinic. I can give you the number, 263-7171, but that would allow the schedulers to schedule a consultation. So generally, it would be a one-time, you know, review and looking at your eye and discussing with you, and then reporting back to your eye care provider.
I'll also add that if you go into the eye screening area, we have a whole list of our doctors on a referral pad, and they can give you that sheet, and it's got all the locations and numbers on it as well. So that might be a good resource.
Hi, this is a question on behalf of my mom. She's 92 and she's in a memory care facility. And initially we had her taking an over-the-counter with lutein and zeaxanthin. And because of her age, we tried to reduce the amount of medication she had to consume. And so we took away any eye supplements. And I did notice over the last 6 months that her eyes got significantly worse. And I'm just wondering, is there any value at this point? She's basically blind in the right eye, apparently, and seems to potentially have lost the central vision in her left eye. Is there any value in reintroducing something over the counter or otherwise?
So this is a great question, and we get this quite a bit, especially in this day and age when a lot of our patients take multiple medications. So their primary care physicians are just trying to limit things to just the essential medication, you know, cardiac, usually cholesterol related. The AREDS2 vitamins, you know, the compound we primarily recommend, has been shown to decrease the progression from intermediate forms of AMD to advanced forms of AMD. So when someone has reached a point where they've really lost central vision and they really have end stage or advanced AMD, we don't really have a clearly proven role for these supplements. And therefore, if really there's concern about swallowing or about using a lot of medications, using it at this stage, you know, perhaps is not as useful as if, you know, this disease was 10 years ago and it was more mild and had a better preventative role. Yeah.
And one last question from the group.
Yes, I have dry macular degeneration in both eyes. One went wet about 4, 5, 6 years ago. I had injections and they stabilized it, but I still have a watery line, vertical watery line in that eye. Is this going to be permanent, or will this be, can this be taken care of? And
Thanks, that's a great question. So most likely, you know, even with treatment, we can reduce, as I had shown, some of that fluid and if people had bleeding, but it doesn't always revert your vision back to where it was prior to developing any changes. So you may have still some lingering symptoms or notice some changes there. Obviously, without an examination, it's hard to know for sure, but that is a very common problem now that we have a treatment, is what happens when you're feeling better, you know, but you still don't feel perfect. And so, you know, that's an area where we're still trying to figure out how do we best treat patients, how can we recover some of that vision that is different or lost, but it may be, at least for now, something that might still persist for you.
Tremendous questions from all of you. We appreciate it. It's really insightful and helpful to us to hear what questions are coming up from the audience. So now I would let us break for 30 minutes. At 10:15, we'll all be back in here for the second really larger session of the speakers. So thank you very much.